Hello everybody, myself Dr. Rajeev Kumar Dubey. On the occasion of this Antimicrobial Awareness Week, I would like to convey that antimicrobial resistance is a serious global health concern. According to an estimate by 2050, 10 million deaths are approximately likely to happen annually. WHO report also indicates that the multiple factors have favored the rise in antimicrobial resistance, namely irrational use of antibiotics, patients not finishing their antibiotics therapy properly, overuse of the antibiotics in animal husbandry, poor hygiene and sanitization, poor infection health control measures in the hospital care settings, and lack of antibiotic therapy. Implementation in a proper way. With increasing uses and resistance to the conventional first and second line antibiotic therapy regimens, the dependency on the last resort antibiotics such as carbapenems and polymyxin has greatly increased. Resistance to these last resort antibiotics has brought us closer to the pre-antibiotic era, unfortunately. So it's utmost need to take the measures at different levels with their stakeholders respectively. Government and healthcare organizations need to actively take steps to prevent the increased uses of these last resort antibiotics by developing strategies and regulations to rationalize the use of antibiotics only when indicated, along with the hospital infection control measures. Plus, the medical fraternity have to use the existing antibiotics wisely and may need to move towards incremental use of innovations such as antimicrobial resistance breakers or antibiotic stewardship, which seems to be a ray of hope in this gloomy era, which is caused by the absence of good and effective antibiotics. Thank you very much for your kind attention.